Health Minister Dr Aaron Motsoaledi says previous research has not shown that exposure to certain chemicals found in sanitary pads actually cause harm to people. He says no evidence was found in 20 earlier studies that chemicals interfere with human health. He added that the recent study by the University of the Free State that reported the presence of endocrine-disrupting chemicals in some sanitary pads and panty liners sold in South Africa does not mean the products actually cause clinical harm. The government addressed the issue during a media briefing this morning.
Findings of ECDs in sanitary pads does not automatically translate into harm in the human body, and that no link of clinical harm was established by the study that brought us here, and that in the absence of reliable data and small sample size studied, no harm to the general public can be said to have been proven. That also that there were no clinicians, endocrinologists or chemical pathologists that were involved in the study. These are special groups of people who, if there was any harm, are the first who could have detected it. The National Health Laboratory Services has not tested any human samples of endocrine-disrupting chemicals because no clinician has ever requested such from their clinical examination of any patient. So when we asked the National Health Laboratory Services what is their experience, they said no, they don't have any because nobody ever requested this from any clinical finding. This is important to note because when there was listeriosis, the first people who detected it, remember that disease which was found in Poloni, the first people who detected it were doctors when they started getting patients. And they sent samples to the National Health Laboratory Services, whose institution, the NICD, the National Institute of Communicable Diseases, is an expert in this field. And they confirmed when we phoned them, doctors are phoning us in the national department. They are seeing something that they've not seen before. Have you detected it? They said, yes. We've already got quite a number of samples which are testing positive. So in this case, they say nothing was ever sent to them from any clinical examination. Also, that SAPRA regards any product that aids a physiological function as a medical product. You are aware that SAPRA used to be called the Medicine Regulatory Authority. The name changed to South African Health Products Regulatory Authority because it regulates all health products.
We were concerned, we were anxious, our members were calling, asking what should we do. But as an organization that has been in this space for a very long time, advocating for menstrual health equity in South Africa, and also even proposed a menstrual health equity bill to Parliament, our first approach was to reach out to the University of Free State to commend them on the incredible work that they have done to bring in light this critical evidence, and which you've already, elaborated on that, which found that about 16 menstrual sanitary pads and 6 panty liners from the most trusted brands and also marketed as most trusted brands in South Africa have endocrine disrupting, chemicals, which may cause hormonal, which may disrupt or interfere with our hormones. But it also states that prolonged exposure can lead to serious sexual and reproductive health issues.